All this clearly indicated towards it being a myositis and not an osteosarcoma. Of course, the pathologist needs to know the history before he can differentiate between myositis and osteosarcoma. All we needed to do was to follow up this patient, and we could see the resolution happening both on X-rays and on MRIs. The next do is to consult a radiologist, a pathologist, a medical oncologist, radiation oncologist, and your friendly neighborhood orthopedic oncologist might come in handy when you are thinking about performing a biopsy. Just be sure you know all you need to know before you go ahead and do a biopsy. The rules of imaging need to be followed. All imaging comes before biopsy. The whole bone needs to be imaged, and the staging workup should be done preferably before a biopsy. One thing that we really need to ask ourselves is biopsy really required? A lesion like this, which is incidentally picked up, which is painless and was picked up only on an X-ray done for something else, probably needs to be left alone. This clearly is a non-ossifying fibroma in the metaphysis of an adolescent, where the X-ray was done for an injury. So not all lesions need to be biopsied, and we need to be careful about this. The next do, and a very important do, is to refer. If a malignancy is suspected, refer the patient to a specialized center before your biopsy and not after doing your biopsy. What kind of biopsy do you prefer to do? In an orthopedic oncologist practice, more than 90% of patients will be diagnosed